Hi everybody, today I'm going to demonstrate how to do a physical exam on a bird. And you guys all know the general. He's here and I'm going to start my physical exam by looking at his environment. So before we ever get the bird out of the cage, we can get a lot of information about how he's doing. So I can look at how he's sitting on the perch. I can see his toes. And take note that he is a nisodactyl, which is 3 toes pointing forward, 1 toe pointing back. But in his case, he's standing a little funny on his perch and has two toes pointing backwards and 2 toes pointing forward. You can see that he has a band on his right leg. He, if you look at him closely, you can see that his cere is blue. And that is a type of sexual dimorphism in the bird for this particular breed. His eyes are bright. I can see his nares, and he does not have any discharge coming out of his nose. I can take his respiratory rate, and I can see that he doesn't have any sores on his legs from here. His feathers do not appear ruffled. I also want to make a note that I'm looking at his environment for any droppings, and I had just cleaned his bedding, his paper towels, so there's no droppings right now. But if we were looking at the droppings, we would want to see that they look normal, that there's no major change. If the droppings look very wet, if they're bright green or colored compared to the usual dark, that could be a sign of a problem. And there's usually, if you look closely, a little tiny wet spot of liquid around the solid feces. So I am going to go ahead and get the general out. And sometimes he'll bite me a little bit, but that's okay. And then I'll just ask him to stand on my finger and probably fly away. So I am going to go ahead and I'm going to go ahead and pick him up and start his exam. Oh. Okay, there we go. There he is. Okay, so for his exam, I'm gonna start by showing you how to restrain a bird. So I use my thumb and forefinger, and I'm using my non-dominant hand to hold his head nice and still. And you can see his spine is in the palm of my hand. I am not putting pressure on his keel or his chest, because birds do not have a diaphragm. And if you restrain them by squeezing them like this, you'll cut off their respiratory abilities, and they can die. So let's start by looking at his beak. Ow, don't bite me. I have a little Q-tip here. And so here I'm gonna just show you his cere is right here. And you can see it's blue, and that tells me he's a male. He's got his nares, or the little nostrils. You can see the little holes there in his cere. And then here's his beak. And he may be a tiny bit overgrown, but I'm going to show you the inside of his mouth. Okay, General, he wants to bite. You can see his tongue. I don't know if you'll be able to see his choanal slit. I'm going to try to hold his mouth open for just a second and show you his choanal slit. Okay, maybe that's not happening today. So have a look at his eyes. They're nice and clear. And birds do have very good vision, very acute vision. Okay, relax, relax. Birds do have ears, but they do not have pinna. So if I part his feathers part his feathers just behind his eye, I should be able to show you his ear holes. There it is right there. Can you see that? Okay, so he has one on each side. Oh, he getting mad at me. Another thing that I do is I kind of let him take little breaks, so don't overdo it, is I feel his keel, and that's the protrusion of his breastbone, and then I feel his muscle on either side of the keel, and this muscle here is the pectoral muscle, and that's where we do a lot of our injections. For the physical exam, you can feel the throat area. Make sure you don't have any swelling. A swelling there could suggest a crop impaction. Okay, and then I also palpate the belly. Now he's a boy, so he shouldn't have any egg, but I do palpate to see if there's any swellings that shouldn't be there. I can have a quick look at his legs and his feet. His toenails are nicely trimmed because he was in class last week, but you can see the 3 long toes coming forward. 3 long toes coming forward, and then the little toe pointing backwards. That's a nesodactyl. You can see his band. Take a little break. Okay. And I'm going to show you his cloaca. So part his feathers, and you should be able to see his cloaca, which is just like a little opening in the feathers on the ventral side of his tail. And the opening for the cloaca is called the vent. And then if you turn him the other way for just a second, if he was a bird with uropygial gland, it would be on the dorsal aspect at the base of the tail, and he does not have a uropyg. He does not have a uropygial gland. Okay. All right. Next, I'm going to. All right. Next, I am going to extend his wing so you can get a look at his wing. Okay. So this part here that I'm feeling right now would be his humerus, and then his radius and ulna would be here. And then this is his digit here. He's not loving it. So I'm going to extend his wing so you can see his 2 primary flight feathers that I left intact for cosmetics. And then I cut all of the rest of the flight feathers, the primary and secondary, along the wing so that he can't fly, even though he still can fly a fair amount. The other side, you can see that it's symmetric, and he has a few of his flight feathers close to the body, and then just his primary ones out to the side. Okay, these are his vestiges, or his tail feathers, right here. I also palpate him along the back, make sure his back feels good. And taking a heart rate on a little guy like him can be pretty hard because they have a really rapid heart rate. And I think that is most of the physical exam that I wanted to go over with you today. So let's see if he's tired of me. He wants to fly away. I've ruffled his feathers a little bit. Okay.